I want you to take a moment to think about the COVID situation and what it's like outside of Canada. If it hits some of the poorest parts in the world and people who are living in very difficult situations, like camps for refugees or for internally displaced people, from the places I've seen in a camp setting, it would be really impossible to socially distance like we're able to do here in Canada. I think of northern Iraq, where people are living either in tents or in containers, and they have to share washrooms and they have to share water points. Another example in Cox's Bazar, where there's almost 1 million people who are living in these really close quarters, very basic shelters, and they also share water facilities. So they really wouldn't be able to isolate themselves from other people because they live so close to other people. If COVID were to hit there, it would really be a disaster. It would be really impossible for people to be able to meet their basic needs without interacting with a lot of others, and the camps just aren't set up that way. They don't have electricity in their homes, for example, and so they wouldn't be able to just watch a movie on Wi-Fi like we might be able to do here. So it really worries me about how quickly the virus would spread if it gets to those camps. What it would mean for us and our teams, for the activities that we're doing. We are, for example, running health clinics. So if a pregnant woman might not be able to go to her prenatal visits because there's a lot of risk for her to be exposed in that way. And so it would be really worrisome. We need to make sure that the virus doesn't spread to these populations. And right now we're working to get ahead of the virus any way we can. And we're trying to make sure that our staff and people that we work with are safe. And we know that we will try to get through this together.